You can hear many different comments for nutrition after gastric sleeve. The main idea of these comments can be summarized as passing the process step by step, establishing eating habits, understanding the necessary and the healthy foods for the body, and avoiding harmful foods. If there is no suspicion of leakage after tests performed on the next day of the surgery, we give 1.5 liters of water to the patient. In this process, we recommend to patients to consume 1 PET glass of water by sipping in an average of 20 minutes. If there is no intolerance, we add clear liquids such as broth, apple juice, linden tea, sugar-free, compote juice, which are easy to tolerate on the second day. You are now discharged and you can consume skim milk, skimmed yogurt, fruit juice, herbal teas at home in addition to the hospital's period. The total daily amount should be around 2.5 liters. You shouldn't drink anything carbonated or with sugar, alcohol, and caffeine. Don't use straw while drinking because it can fill your stomach with air. Stop drinking if you feel fullness, pain, or discomfort. In addition to these liquids, you have to start 50 grams of protein and 1 multivitamin per day on 7th day of surgery and continue for 6 months. If you want to increase the variety again in this period, high protein, vitamin balanced soups, shakes, which are specially produced for bariatric patients, can be good alternatives for you. After second week, you are better because you will be able to consume also blended and mashed foods. You shouldn't forget that you can only consume these foods at main meals and shouldn't consume more than 150 grams on meals. Also, we recommend to take liquids, yogurt, soups as snacks between the main meals. When consuming, eat slowly, use small cups and baby spoons. Your meals should take at least 30 minutes. In this rule, you should take care to consume water or other liquids 30 minutes before or after meals. This will reduce the risk of nausea, vomiting attacks, and enlargement of your stomach. You can consume chicken and lean meat puree, fish lean ground beef, egg white, curd cheese mixed with yogurt, cottage cheese, fruit purees, blenderized boiled fresh vegetables in this period. Don't use spices, onions, garlic, tomato paste, or use very little in the preparation of the foods. You can use very small amount of salt. Although mashed potatoes are not preferred because of their high calories, if need, you can dilute them with broth and consume them in small amounts. Avoid rice, bread, and pasta. After the 4th week of surgery, dry vegetable purees such as hummus, juicy broth, bean puree will be good alternatives for you with their high protein content. We switch to normal foods after the 5th week. But you shouldn't forget not to consume sugar and very little amount of carbohydrates. You should eat slowly by chewing and eating in small portions. Nevertheless, the 30 minutes rule should always be followed. Don't be worried about new foods. Try the new foods one by one and check your stomach tolerance. If there is an intolerance, take notes and consume it a few weeks later again. You should prefer boiling, which is easier to achieve, as a cooking technique for meats and chickens. Finally, we must obey 3 main meals and 2 or 3 snacks. Main meals should be consumed slowly and by chewing for 20 or 30 minutes. You should stay away from sweets and sugars, don't forget.